Looks like we have a quorum, and I was the one who made it complete, so we're ready to get started now. The mission of the NGH is to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. I call this meeting to order. I want to give opportunity for conflict of interest, opportunity for each member to disclose potential conflicts and their belief that they can be unbiased and able to participate, or that they elect to recuse themselves from the matter. At this time, do we have any public comments?
No, sir.
All right, you have in your package the April minutes. You've had a chance to review them. Are there any amendments to the amendments? If not, we'll entertain a motion to adopt those minutes.
So moved.
Second.
Been moved and proper second. All in favor, vote by the sign of aye. All opposed? Ayes have it. All right, awesome. We're now ready for one of our continuing old business items, which is the hospital utilization and marketing report. Ms. Kathy Poole, you're recognized.
Good afternoon, everyone. Before I do the utilization report, I want to go ahead and bring up Mr. Jerry Maynard with Community Health Marketing. So he'll be giving a government relations report tonight. Thank you.
Thank you, Kathy. My name is Jerry Maynard. I'm former president of Community Health Marketing. My sister took over 2 years ago. She could not be here tonight because she is in Orlando, Florida for a convention. But I stand here today because we have special guests that are going to be coming forward pretty soon if they start coming, because this is a special day. It is a special day because we are celebrating the passage of a bipartisan bill for the State Employee Healthcare Incentive Act. It passed the state Senate 29-0 with only one abstention in the House. With the political environment that we have today, that is a great accomplishment. There was a lot of work that was done, but the leadership in both the state Senate and the state House was phenomenal. In the Community Health Marketing, our team consists of Stephen Lindsay, who is our Director for Federal Affairs, and we also have Nadira Freeman, who's the Director of our Metro Council Affairs. And then we have our special partner, Megan Frazier, who runs our state affairs, where she represents Nashville General Hospital. She was strongly instrumental, and we thank her. And if you don't mind, if we could just recognize her. It's my honor to introduce to you people I've known for over 20-something years. And the sponsor of the bill for the State Employee Healthcare Incentive Act was Representative Darren Jernigan. I believe this was his last bill that he carried in the House. Following him, we also have State Representative Jason Powell, who originally filed the legislation. And then we have State Senator Heidi Campbell, who carried the legislation along with Senator Mark Pody in the Senate. Again, this was bipartisan, 29-0 with only one abstention. We have 70,000 state employees in the Middle Tennessee area, not including their families. This is a huge opportunity for us. Darren served with me on the council when we passed the Metro Employee Healthcare Incentive Act. He co-sponsored it with me, and that passed unanimously. 15 years later, he carries the same bill for the state. I'm going to get the microphone, and if you will give a round of applause to all three as they come to present.
So I'll lead us off. Thank you for the introduction, Jerry. Really appreciate that. I'm Jason Powell. I represent District 53 here in Nashville. Basically, that's most of South Nashville. Wanted to say that, as legislators, we have a lot of different people and groups come up and meet with us. Have the honor of having Dr. Webb and Jerry usually come up once a year and make their visit to the Hill to talk to not just me and the members of the delegation, but others about how important our public hospitals are. So last year on that visit, we got to talking and, said, hey, you guys come up every year. I don't know how much longer I'll be up here, but is there any kind of legislation that you've ever, looked at or want me to carry or think would be helpful to pass? And so we started talking about several years ago, prior served one term with him, but Senator Douglas Henry had actually looked at this exact same program, making it so that our state employees had the same benefits that Jerry and Darren and Bo Mitchell carried in the council, to make it so that our city employees can come and use General Hospital, those same incentives for state employees. As we know, we have so many different state employees across the state. So we took that to heart and wrote that down as a good idea, and then came to draft this piece of legislation going into session this year. Called my good friend, Senator Campbell, and said, would you be interested in sponsoring this? And to my delight, she said, absolutely. So we introduced the bill. Originally, it was drafted so it would open up to all public hospitals in the state of Tennessee, because we thought that was important. We have a very interesting process in the House where the bills that we draft often have to go through a fiscal review process. They came back and there was a fiscal note on it, which usually that's the death knell of any bill, is when it gets a fiscal note, because it's tough to get those funded. But we were patient. We had Dr. Webb and others get on the phone. Megan Frazier, who was instrumental in helping pass this from a lobbying perspective at the state. We all got on with fiscal review. We met with the benefits board, explained to them how this should really not have a negative fiscal impact. If anything, this should have a positive fiscal impact, because everything it's going to do. So we were able to get the fiscal note removed and move the bill forward. I was able to get it through the health subcommittee, and then it got to the full committee. And we live in very interesting times. Might have gotten a little wrapped up in some of the politics with some other events going on. And I kind of, to say it lightly, wasn't the most popular person up in the Tennessee General Assembly. But I have the really excellent fortune of my seatmate is Darren Jernigan. And he had actually carried this, as Jerry referenced, and helped push this through in the Metro Council when he served there. So he's actually even more knowledgeable about this piece of legislation than I was. Didn't even realize that when I drafted the bill originally. So Darren was generous enough to say he'd be willing to take this bill on. I was signed over to Darren to sponsor the bill, and kind of took a step back, and he helped guide it through the more difficult process. But I just want to say, I'm going to hand it off to Senator Campbell. I think this is a really important key piece of legislation. You know, a lot of the things we hear about that happen at the state, that get all the headlines, those things matter. But what matters the most are pieces of legislation we can do that directly benefit and help people. And not just help people, but help the public institutions that the people of this city and this state rely on. What's really exciting is I had some of our Republican colleagues say, you know, we want to take up this piece of legislation, expand it to our community. You know, the only thing we don't like is we had to take this and isolate it just to Metro General and just keep it to Nashville. So that's exciting. This is a great piece of legislation that's going to have a tremendous impact for state employees. Hopefully it's going to create a very positive benefit financially for Metro General, and appreciate all the work that you do. But thank you again for having us. Again, wouldn't be here if it wasn't for Megan Frazier and all the work she did, because she went, I think she met with all 100 and however many of us there are, 32 of us, to make sure that we're all understood the bill, because it's a very complicated bill, but it's actually very simple, but it can be difficult to understand. So we're very appreciate everything you do, and I'm going to hand it off to my colleague, Senator Campbell.
Thank you. Had to lower the mic a little bit. I just want to applaud Rep. Powell and Rep. Jernigan, because this is such a perfect example of doing exactly what's right for our city and for our state, and not thinking about their own personal careers, but thinking about what's good for people over their careers. And so he described the bill process to you, but I just wanted you to know, first of all, how grateful I am to all of you for everything that you're doing for Nashville General. I'm very concerned, like many of us are, about the future of safety net hospitals in Tennessee, and first became aware of some of the issues with Enoch Fuzz, and he introduced me to Dr. Webb. And since then, Dr. Webb has been just vigilant about interacting with the legislature and making sure that he was up there to support this particular piece of legislation, and also looking at, other things like whether or not we can help with land possibilities and potential and things like that. And so I'm really, really grateful to Dr. Webb for his leadership on this and for, helping us get this over the finish line. And Megan Fraser also, by the way, did an amazing job in the Senate. It was touch and go. 2 times I had to roll this bill because of other political stuff that was going on. I don't know if you noticed, but there's a little bit of drama in the legislature sometimes. And Megan was a stalwart defender of this bill and making sure that we did the right thing to get it across the finish line. So it was really a team effort, and I was called to be on the team, but certainly was not leading this charge. This was Rep. Powell's bill, and so I just appreciate the opportunity to have worked on it. Thanks.
Slam on microphone. Dr. Webb, you ain't get a new one because when I'm done, I'm going to drop the mic. It's probably more expensive than the regular mic, but anyway. So I can't say more than what they've already said. Jerry and I and the Metro Council did pass this. It was an incredibly successful program. But the players and the partners that we had, Dr. Webb, Jerry, and Megan, who went to 95 offices, which when you're a representative, you can't make it to 95 offices. You don't want to go to 95 offices. But it makes it a lot easier when your colleagues know what the bill's about. And she should be commended for that. Representative Powell and Senator Campbell did mention politics. Great bills. Do not escape politics. Davidson County bills do not escape politics. Davidson County bills with authorities do not escape politics. We did manage to get the East Bank Authority out, but that was last day and it had politics. But I say this and I want to also give a recognition to Leader Harold Love, who, after I took the bill over, stood with me in committee and on the floor because obviously he had a lot more intimate knowledge of the hospital than I did. I mean, I know the mechanics of the bill, but in case there was questions I couldn't answer, I was glad he was there. So it was my last bill. I'm retiring in November, but it was my last bill on the floor. I can't think of another bill that I would want to go out on, and for that. But I guess the lucky thing is when it's your last bill, they don't ask you questions. They just thank you for your service for the past few years. So I don't think I didn't. There was no debate. So and I think a couple people want to say something, and to reiterate what Representative Powell says, there is a hunger to expand this to rural counties for state employees. Jerry mentioned the state employees in Davidson County. My house district is number 2 where state employees reside in the state. I learned, I guess it's still the same. I learned that when the Team Act stuff was going through. It's probably pretty high for you since you overlap. I'm going to check that. So thank you. I'm not going to drop the mic, but symbolically I would, because it's been a great, this was great for everyone. And congratulations, everybody.
And just one last thanks to Jerry Maynard, too, because he really, really helped us get this over the finish line, too. Yeah.
Thank you. Careful.
Are there any questions from the board? Mr. Chairman, thank you.
Yeah, no questions, but I do want to just say on behalf of Nashville General Hospital and and also all of the staff and this board. Thank you for your leadership in this and just amazing work. So it is, Middle Tennessee is getting a little bit more expensive to live in, and so every opportunity a little bit helps. And so being up there and working this hard to make this happen, this is a big deal, so we appreciate it.
Thank you. Thank you.
Yes.
Is this an appropriate time to ask a question of Mr. Maynard? Is it appropriate at this time to ask a question of Mr. Maynard that doesn't have anything to do with this great success?
Yes.
Great. Thank you, and congratulations, Mr. Maynard, to you and your staff in your contribution to making this happen. This is a big deal. My question though is, can you tell us a little bit more about, we seem to be in kind of never land as it relates to our new hospital and property for a new hospital. Can you give us an idea of what you think the next steps ought to be with the administration that we can move things forward?
Wow, thank you. First, I defer to the leadership of this hospital, both the chair and the CEO, as well as the board. However, formerly serving as a chair of Health and Hospitals and vice chair of Finance, Full Budget and Finance for Metro Council, when the mayor gives the state of the Metro and the mayor states what his priorities are and that he's going to use the full force and authority of that office for those priorities, we have to be delicate in working with the mayor to make sure that we stay not only before his office, but working alongside his office without getting too in front of his office. So we don't mind being a step in front, but you don't want to be 10 steps in front of the mayor given where they're going. The other thing is that we need to make sure that we're working, that every board member here is letting the mayor know that there was a commitment to forming a committee to look at land and what land is appropriate for acquisition, and then transferring that land over to Nashville General Hospital. And so that commitment has been made. We need to continue to be vigilant in talking with the mayor about forming that committee, having that committee do its job. Then second, working with the Metro Council members. We need to continue. That's what we've been doing ever since, for the, I don't know how many years, Dr. Webb, we've been working on this. We talk to Metro Council members every week about this new hospital, the urgency. We want to move forward, but we want to also work with the mayor and the mayor's committee for the land acquisition or the identification. Finally, what we've already also been doing, for your question, we've been working with our state delegation of Davidson County. We've gone beyond that. We've been working with delegates or state representatives and state senators from West Tennessee, Middle Tennessee, Chattanooga, Knoxville, because they all have public safety net hospitals. And we've formed a strong relationship with Congressman Mark Green. Congressman Mark Green has given the endorsement for a new hospital. Congressman Green has said he will do anything and all things necessary to help us get a new hospital. And so we will continue. Senator Heidi Campbell has also said she would work with us with Governor Lee to help us if we need the governor's assistance or the state's assistance in helping us identify, not identify the land, but once the land is being identified, to make this deal go through.
Mr. Maynard, thank you for that, and I respect you and your position as our political guide. I would just ask, and maybe we can do this outside of a board meeting, to have a discussion about what recommendations you might have for the board specifically to do the kinds of things that will help move this issue forward.
I appreciate that.
Thank you.
That's good.
Thank you.
Thank you. Let me add one piece to that. What Maynard shared. I had a conversation with the mayor's office several weeks ago in terms of timeline, and one of the things that we talked about was just getting through the budget process. And the mayor's office asked if we would give them the opportunity to get through their first budget process and before we lean too heavy into the next direction. And so that's kind of been a little bit of the delay. So we're giving a little bit of respect to that request. So I wanted to add that component to it as well. All right, Ms. Poole, you can continue.
Okay, well, thank you very much. And just kind of to add on some of the initiatives the mayor's office has, obviously transportation is one of the big ones, and that even affects us and our patients. So in certain events we've been at, go out and help navigate that and lend a voice to why that transportation plan is important, for our patients as well, because that transportation is a big issue. I'm sure someone from our care coordination team could probably spend a whole hour talking about the challenges some of our patients have. But as we look at our scorecard that we keep for marketing, one of the things specific to utilization is our Metro employee base. And we just obviously are very excited about the opportunity to work with the state employees. We have a lot of lessons learned from the Metro Incentive Program. It's been in place since 2009. And we really understand it can't just be us pushing information out. We have to get within the specific Metro departments, get their trust, show up and be there, and have them meet our physicians. Like, they want to see the providers when we have health fairs and things along those lines. Currently right now, for our volume of Metro employees, since the beginning of January, we're averaging about 370 employees per month. And that's from a total hospital volume of about 8,000. So we do have a lot of opportunity there. And we continue to work with those Metro departments and Metro HR to try and get those numbers higher. One of the things, and Bruce could probably talk more about this, what we do want to happen with the state employee plan is on the front end, go ahead and have Blue Cross and Cigna put our insurance information, or the hospital information, be a tier 1 is the term he uses. I don't know, Metro HR scares away from that one. But so that when employees do come here, everything's zeroed out. Their their explanation of benefits that they receive from Blue Cross or Cigna will say amount owed provider 0. It's confusing because on the Metro side, it still says you owe the provider. So if we can get that done on the front end, I think it would probably save a lot of time and effort to win the trust of those state employees. So we are excited about that. Any questions?
Any questions? Mr. Lester?
Ms. Poole, do you have any idea that we are any closer to getting the H designation on the interstate highway at the exit so that people will know there's a hospital
I
here?
am not.
Okay.
But we do have people that just left that are, have that on their ticker.
Well, quite candidly, I was hoping we were going to get a more full political report from our consultant, but I guess that's maybe for the next meeting.
Okay.
Is that it? All right. We don't have to approve that report. It's just for information only. Thank you. So we do have we do need a motion to go into closed session, strategy session, and there's a couple of things we'll need to address there. Then we're going to make an adjustment to the agenda so that we can get to the audit report immediately coming out of our closed session. So we'll entertain a motion now, and then we'll have a roll call vote for our strategy session. Can you get a second? All right.
Dr. Burley? Yes. Dr. Fagans? Yes. Dr. Hudson? Yes. Mr. Lesser?
Yes.
Dr. Martin?
Yes.
Dr. Miller?
Yes.
Ms. Smith? Yes. Mr. Stevenson?
Yes. All right, we are adjourned to our strategy session at this time. I do want to make just an agenda change at this time, as prerogative of the board chair. We're going to now move to our finance report so we can hear from our audit report. So Bruce, you're recognized at this time. This is something that we will need to approve.
Just this evening, I guess, we have our auditors from the Crossland firm that completed the hospital audit for 2023. Principal David Hunt, who's been with us for quite a few years, and Angie Hoke, who was primary on the audit for us this past year. And I'm going to turn it over to David. Thank you.
Well, good afternoon. As Bruce said, my name is David Hunt. I'm a partner with Crossland, and we're the auditors for the hospital. A few things, I won't take a whole lot of your time, but a few things I do want to touch on and bring to your attention. First of all, we met with the Finance Committee earlier today, and we spent well over an hour going through a number of things. You've got a couple of items from us in front of you. There's one booklet. It's called Audit Results for the year ended June 30, 23. It's kind of in a white cover. And then there are the financial statements themselves and the related disclosures in the blue cover. We covered both of these with the Finance Committee. The results, the audit results, there's no financial information in this. It's basically just informational that's required under the auditing standards that we pass along to representatives of the governing body as it relates to the audit. And we did that with the Finance Committee. But it describes things like what an audit is, what our responsibilities as the external auditors are, what management's responsibilities are, and some other information like that. The financial information is in the blue cover, the financial statements, as I mentioned. There is on page 7, it's historical information, so I'm not going to go through it with any kind of detail or anything. But I do want to bring to your attention on page 7, the MD&A, Management's Discussion and Analysis. This is actually prepared by Bruce, and it gives you great information about the results of the hospital's financial activities for the year, both from a statement of financial position standpoint, a balance sheet standpoint, if you will, and from the statement of revenue and expenditures, and changes in net position. So it's good information, it's summary information, but it gives you good examples of why things changed year over year from last year, from 22 to 23. So I wanted to let you know that. Other things that we covered, and probably the most important thing that we went over today with the Finance Committee is some of the findings that we had during the course of the audit. Those can be found starting on page 44. And there were 5 items that we brought to the Finance Department's attention as well as management. One related to patient AR and revenue recognition and recording, and more specifically related to the allowances that are developed against AR for collectability. So we had some suggestions there. We went over what we found. We went over those suggestions, and then there also is included management's response to our findings, and it is in the booklet as well. So you can see what they're. I think for the most part they agreed with most of our findings and have set about a plan to rectify those findings. So there was one related to patient AR, one related to the financial statement close process, one related to tracking construction in progress, and one related to the accounting for leases, and then finally one related to the accounting for safety net revenue and deferrals. So we went over in detail with the Finance Committee these findings, and Bruce spoke to what the accounting department here at the hospital are going to do about it to rectify those findings. I think and Christy had a good thought, asking how you boil this down, what are the root causes of these things? And part of it was personnel. They had some issues in 2023 with some of their personnel being on site or being out sick for quite extended periods of time. So I think that's being rectified, or in the process of being rectified. Developing policies for some of these things that we brought to their attention, formal policies that can be followed by whoever is involved in those processes. And then finally, communication between departments to get information timely to the accounting department so they can make the proper transactions or record the proper transactions in accordance with generally accepted accounting principles. So I think those three things, are kind of how you boil it down. But I know management is committed to getting those findings corrected, and so that's really our report. If anyone has any questions, I'd be happy to address those. All right. Well, thank you. Appreciate it.
Thank you. Ms. Smith, you want to give me the recommendation from the Finance Committee?
Yes, we spent a lot of time discussing this, and I agree with kind of the boiled down version of the 3 bullet points. And we have some action steps that I know Bruce has committed to kind of leading, and we'll follow back up with him going forward. But we had a unanimous vote to move this through to full board. So,
thank you. Okay, Bruce, we're going to go ahead and entertain a motion to adopt the audit report.
So moved.
Second.
Been moved and properly second. All in favor, vote by the sign of aye.
aye.
All opposed? Ayes have it. You may continue.
Thank you. All right. Our March financial performance, pretty good. We had decent volume, inpatient volume of 205 admits, 174 observation admits. Our patient days are about 15% below the budget, but that's a positive because all year this year, we have run about 12 to 15% below our budget on length of stay. So we get paid the same whether the patient here is 4 days or 5 days. So our ability to move those patients through more quickly allows us to take care of them. Charges may not be as high, but collections are the same, and the level of effort to take care of that patient and the resources are less. So we actually do better with shorter lengths of stay. Our emergency volume was actually down a little bit in March, about 178 visits behind budget for the month. Year to date, if you look all the way across, you can see our ER visits are basically flat with the prior year. We have some new kind of exciting things going on in the ER to take care of patients more expeditiously. We've got patient to bed in the ED these days in the 3 and 4 minute range every morning when we listen to it. That's a new initiative put in by the hospital. Some of you may have even heard our commercials on the radio, but we do expect to see some increases in volume in the ED, and 80 to 90% of our admissions ultimately come through the emergency department. So growth there, it helps the hospital quite broadly. Clinic visits were slightly above budget at 3,600. Our inpatient surgeries dropped again this month, down to just 18. Outpatient volume is pretty solid, surgeries at 101. The cath lab volume was down this month. I think we had our interventional guy was out for one of the weeks, and so that dropped off this month. And then deliveries we talked about, they've been kind of low for really the last 6 months at the hospital. Last year, deliveries grew 20%. This year, they're down about 18% compared to last year, almost where we were 2 years ago. So definitely some opportunity. We have capacity on the 4th floor. We can certainly take care and deliver more. Going to the income statement itself, our inpatient revenues were about 12% behind the budget. That's related to the number of patient days. So shorter lengths of stay, they generate less charges, but we still can harvest the same amount of net revenue from those patients. Our outpatient revenue was about $1.1 million behind budget. That's that OR that we talked about being behind budget, and our ER being behind, and also our observation days in the hospital were down pretty significantly versus budget. But net revenue was $5.2 million, so slightly better than the budget. That's good payer mix and moving patients through the system quickly. And then again, as we've had most of this year, our other revenue has been substantially above. We actually got our cost report settlement in the month. It came in at about $3.9 million, which was a little better than we had anticipated, so that had a positive effect. for the month of March as well. So in all, our net revenues at $14 million against a budget of 11.6, $2.5 million positive there. Expenses were high. Salary expenses bumped up over the $5 million mark, about $500,000 higher than budget. And our contract labor is still a challenge, getting positions filled broadly in the hospital, not just nursing, director roles that we have in the hospital and other parts of the enterprise. 1.2 million, so almost 400,000 higher than the budget. The good news is, even though our expenses were $1.5 million higher than budget, our revenues were $2.5 million better than budget. So we ended up making $650,000 for the month against a budgeted loss of $360,000. So positive, a little bit more than $1 million for the month. And for the year to date, we're at about a $5.4 million positive margin. Last year at this time, we were a $7.4 million negative margin. So you heard what we talked about the state employees being available to us in January. That would be nice commercial business. The one thing we have in this hospital, in our system, we have capacity. We're a 24-hour operation. We have capacity in our ORs. We have capacity in our imaging. We have some capacity in our clinics as well. So more is better for us because our overhead is pretty well fixed. So I think we have opportunity to grow, and that's the goal for 2025 budget.
Is the OB reflective of any change in staff, or we have the same number of providers that we did a year ago?
I don't think there's been any I'm gonna look at Veronica. Come on up. I'm sorry. You're fine. There you go. Come on.
So there has been some age attrition in the Meharry Medical Group. And then, as you all know, we started our own NGH practice. We do have Dr. Wynn that's here, and we'll be starting a midwifery program that will be up and running within the next month. So the answer to your question is yes, and we do have a plan. Any additional questions? Thank you.
Just one question. How are we doing with cardiology staffing now? Have we added any cardiologists?
Dr. Brand, I mean, we have. I'd rather let the experts talk. So
we have, to your question, Dr. Martin, yes. And if you look at the numbers, I was showing this time last year the same numbers to Ms. Nairmore and Dr. Blackledge. We've actually went up about 15% in numbers, and our no-show rate was around 50% last year. This year, our no-show rate is down to 19%. So we do have a cardiologist that we have a letter of interest out to and sign a contract. We have an interventionist that will be joining us in early September. Any other questions?
I would have gotten that one right, actually, but I would rather let Mark tell you that. Anyway, we have opportunity, I just say, in the hospital as a whole to grow. And I know that change out in cardiology is painful and historic, but with 1.5 cardiologists, we're seeing more patients in the cardiology clinic than we did with 3. And they're coming to their appointments at a higher rate than they did before. I'm not, for whatever reasons, that's beneficial. And we have a net new cardiologist starting in 2 months, and then another one who we've got a letter of interest that Jana and Dr. Williams have been working on. So we should be pretty full and ready to go by the fall for cardiology.
That's good to know. Any other questions or comments on our finance report? Ms. Smith, did the Finance Committee have an opportunity to review?
We did. We reviewed the overall results and the specifics and unanimously approved to go to the full board.
All right, I'll entertain a motion to adopt the financial report for March. It's been moved and properly second. All in favor, vote by the sign of aye. Aye. All opposed? Ayes have it. Do you have something on the budget?
I do.
Okay,
I'm
thank
sorry, we went out of order. That was my fault. I think most of you know that Dr. Webb and I went and presented the original budget that the board approved back in March. And back in early May, we had the opportunity to attend council. And with the mayor's recommended budget came in $4 million less than what the hospital had requested. And so we are going to have to come back to this board with a balanced budget in the June board meeting. But we are still working through that. So we're looking at both revenue opportunities and expenses as well. And we think we've got at least the first 25% of it covered, and we're working on the rest right now. So we'll be back end of June with a balanced budget and possibly an increased allocation from Metro. We're working on it.
Thank you, Bruce.
Thank you.
We're going to go back to new business, and we have one item that needs our attention, particularly the recommendation from the Metropolitan Department of Law concerning the estate of Frances May Mashburn. You have that in front of you for approval, but if there's any discussion on that, we'll entertain that now. If not, I'll entertain a motion to approve.
So moved.
Can you get a second? Second. Moved and proper second. All in favor, vote by the sign of aye. Aye. All opposed? Ayes have it. We're now on our contracts. Dr. Mark Brown, you're recognized for the facility survey contract.
Okay, on the facility survey contract, that's a current contract that's been in place. The reason this board has not seen that contract because it didn't meet the threshold, but we've been using this company for the last 3 to 4 years. The reason why it's come before the board this time is because they submitted a contract for a 3-year contract where we were doing 1 year prior to that. So that's why it's up here before the board. This contract is used for our work orders, our space planning, our rounding for regulatory, and for our supply, central supply.
Thank you. Any questions or comments on this particular contract? Ms. Smith, review from Finance Committee on this contract.
Finance Committee has reviewed this contract and moves to, unanimously approved it to move to full board for approval.
Seeing no further discussion, I entertain a motion on this contract.
So moved.
Second.
Been moved and proper second. All in favor, vote by the sign of aye. All opposed? Ayes have it. Dr. Brown, you're recognized on the pharmacy project.
Okay, the pharmacy project is a project that's going to be housed at the Metro Center. Like I shared with the Finance Committee, they see approximately 60 patients a day with just the primary care there. There's a lot of business opportunities within that area. We're going to be doing the physical therapy in that area. So we find that this was a good place to house a pharmacy, and it is a good business opportunity for us to market to the local businesses that surround us.
Is that the build-out cost?
Yes, that's a culmination of different things, the minor construction, shelving, software, security wear, and that kind of stuff.
Questions or comments on this particular contract? All right, Ms. Smith, the report from the Finance Committee.
Finance Committee did discuss this with regard to saving some conversation around the multiple projects and security shelving, security system, and also the bids. The fact that there was not multiple bids received, we did decide to go ahead and unanimously approve to move this to full board.
Seeing no other further discussion, I'll entertain a motion.
Second.
Been moved and properly second. All in favor, vote by the sign of aye.
Aye.
All opposed, ayes have it. And Nurse Elders, you're recognized for Space Labs.
Thank you. You have in front of you the Space Labs contract. It is an upgrade to our telemetry for our inpatient areas. It's $411,000. We did originally submit this as an equity subscription, but have been notified that we did receive 1.8 of the capital from Metro recently to cover this particular project. Any questions?
Are there any issues of this being compatible with Cerner?
Not to my knowledge, we have, yeah, not to my knowledge, it's very good.
Did you get that right?
But thank you. Any additional questions?
Ms. Smith, report from the finance on this particular contract.
Sure. Many of the Finance Committee remembered us speaking about this in the past. It gives us great comfort to know that this is part of the 4% money that we were allowed to receive and see its value. So we unanimously approved it to go to full board.
Seeing no further discussion, I'll entertain a motion to approve.
Second.
It's been moved and properly second. All in favor, vote by the sign of aye. All opposed? Ayes have it. And Ms. Thompson, you are recognized for the Oracle contract.
The contract I bring before you today is Oracle Health Consulting as an extension and interface work. This will cover us shifting our go-live date from June to December. This would cover training, interface build, testing, and just the time allotted to get us from June to December. This contract goes over 120 payments, so 120 months, so we're not incorporating this all at one time. And it does have some language in there about travel costs, but we do not anticipate any travel costs necessary for this extension above and beyond what was initially provided to us.
Questions or comments? Seeing none, I'll entertain a motion to adopt.
Second.
Been moved and properly second. All in favor, vote by the sign of aye.
Aye.
All opposed? Ayes have it. Thank you. All right, we now have, for information purposes, our foundation report.
Thank you, Mr. Chairman, and good evening, Board. Thought for our very first report from the foundation in quite a while that I'd give a little bit of background, initial observations, and how to build a world-class foundation and how can you guys help out with that. So want to start out with a little bit of background about myself. I'm originally from the Queen City, which is the city of Buffalo. I have, years of experience in healthcare as a direct provider. I started out my career as a radiation therapist. So for over 16 years, I treated cancer patients. But I have to say my first touch point in healthcare was a candy striper at Buffalo General Hospital when I was 15 years old. Fell in love with the patients, fell in love with the work. So I have deep roots in healthcare. I have always worked either in healthcare, in a development role, or human services. So I feel like I have a pretty good background with that, as well as working for national organizations. So in that role, really worked a lot on the business end of fundraising and development. And believe me, there is, it's a real business at times. So that's a little bit of my background. So initial observations. So I've only been here about 3 months, but in that time, it's pretty quick to kind of get up to speed of what the foundation is currently doing and then recommendations moving forward. So my initial observations are consistency in messaging. We have to continue to be consistent in our messaging. I might say, oh, geez, what is that? So it's patient stories. So in the foundation and development world, we are storytellers first and foremost. Consistency in our actions. So whatever we're doing, whether it's events, whether it's special campaigns like an employee campaign or our Project Warm campaign that we do for our patients, we need to do those actions consistently just because our community expects that of us and we should be serving our community. And then finally, consistency of impact. This is the number one thing that foundations don't do well, if there is something, and that's sharing the story and sharing the good work that with our donors and the support of our board, what impact we're making in our community. So telling those tangible stories about, what exactly the foundation is doing and how we're making an impact. And so that would be through newsletters, that's through donor impact reports. It's a lot about communicating. It's a lot about being transparent and communicating. So I had a really cool slide that unfortunately our technology didn't work tonight, but it's a really great image of a successful world-class foundation. And it's basically constructed by a pipeline. And so all the way from donor acquisition to cultivation, to mid-level, major gift, planned gifts, as well as capital gifts. And to be a very successful world-class foundation, every aspect of that pipeline needs to be in motion and working. Are we there yet right now? No, we're not. Can we get there? Absolutely we can. And so how can that, so that kind of leads to, how can you guys help? And how can you help the foundation? There's a number of ways. So first of all, it's, through your leadership, being ambassadors of the foundation. And I'm hoping that continued board meetings, I can share some of that with you so you guys can go out. And if anybody in the community asks you, you know exactly what's going on with the foundation, some of our key initiatives. I know we're talking about a new hospital down the road. That's going to be a really big thing. So moving forward, really good communications between the foundation board as well as the hospital board. And that just has to happen. I also need you guys, honestly, come September, you're going to be really hearing from me because we are going to launch our first leadership campaign. And what is that exactly? That's leadership of the boards, leadership of the organization. Certainly you guys are part of that as well. So I'll need you guys to look at that, be a part of it, participate, because we really set the tone for the rest of the fiscal year. Some other things that are coming up. We will once again have our Project Warm campaign that will be launching in August. As I mentioned, we have the Leadership Giving campaign in September. We are bringing back the employee campaign as well. We will also be having the Art Open House. And I'm really excited that we're kind of in the final stages of organizing an International Women's Day breakfast that will be happening the first Tuesday in March. So more details on that, and that will support some of our women's services here. We have a few more things up our sleeves, but I'm not really ready to announce that. So I guess at this point, just a really quick overview. You're going to hear more from me. I could talk hours about every aspect of the donor pipeline, but I just thought that would be a really good overview for tonight. Any questions?
I think that we do have a lot of opportunity in Nashville. I'm not aware of the foundation having gone to major corporations. One of the things that you need for that is a product. What are the priorities of the foundation? So are the priorities family services, social services, employee assistance or something, but it seems like you've got to have something that you're really directly asking for, or if the donor has any specific ideas of what they would like to do with the money. But it seems like we've got to have some priorities of what we're going to use the money for.
You're absolutely right. And, you know, a lot of people don't like me saying this, but probably about 85% of all gifts are restricted. So you do have to have priorities. People have passions, and it's my job to connect those passions and also connect it to some of the priorities of the hospital. So really the foundation, our sole purpose is to support the priorities and efforts of Nashville General Hospital. And so we will get some of that direction from Nashville General Hospital and Dr. Webb.
You go ahead. Okay. Thank you. So I've actually worked a lot with foundations. I've started one here in Nashville as well and managed the money. So I actually have a little bit of intel in this. A couple things that come to mind that I'd love to, and I want to belabor the point and take all the time, but just I'd like to ultimately see, so maybe we schedule some time, but I think this would be helpful from at a board level. An investment policy statement regarding the assets, this withdrawal rate, sustainable withdrawal rate on that, the staff that would be supporting that, discussion about restricted gifts, IRS filings and how we're doing that, and some of the other things that are required by law that we file, and public-private partnerships and discussion around the estate and tax planning. So there's a lot of different things that come into this. It feels like we've talked a lot about marketing, which at the end of the day, we have to have the visibility, but we have to run the foundation correctly. So I just want to make sure that everybody is on board with the actual administrative operational piece that really goes along with the ask. And I think otherwise you can, quite frankly, open yourself up to a lot of liability. So I'm excited it's here. I love nonprofit and board work, obviously, but I do want to make sure that you have the staff and appropriate personnel to help you achieve the best use for this foundation. Thank you.
Well, no, I really appreciate you mentioning that and recognizing that that is a major piece of foundation work. And there's already structure being put into place for that. But as I mentioned before, I worked for a lot of national organizations. What wonderful experience that is on the business end. And foundations are a business as well. So no, I appreciate those comments.
Well, I just wanted to welcome you to Nashville General. You said 3 months, so welcome.
Thank you.
And I appreciate the passion. I love it. You referenced a slide that you wish you could have shared with us this evening. Is there any way that we can have that sent out to board members so that we can
Absolutely.
review that? Okay, thank you.
Thanks, Mr. Chairman. And I too want to welcome you, Jen, again, and hope that throughout this entire process of all of the suggestions that you've heard, you'll hear more, all of the things that your experience brings to the table, that over a period of time, we can get you to incorporate the word y'all in the phrase. So
sometimes it slips out.
Okay, well, we're going to merge that Buffalo Southern accent together. I would also be interested, among all of these things, to understand what kind of goals you have from a financial perspective. Mm-hmm. You know, are we trying to raise $5 million? Are we trying to raise $200,000? And how specifically we're going to do that? And what will our board responsibility be to support that effort moving forward? But I appreciate your being here and really look forward to working with you because, as I think everybody here has suggested, there's huge opportunity for the needs we have, but also for the opportunity for the pockets of wealth that exist in this community. And I just think this is fantastic. Thank you.
No, I want to thank you very much for those comments as well, because yes, I do have some goals, but in general terms, all I'll mention right now is that we do have initial benchmarks. Going to look at those benchmarks. And then one thing I failed to mention before is that there is going to be a capital campaign study for the new hospital. And as part of that study, we're going to be able to pinpoint the potential. So what is our benchmark? What is our potential? And that in between, what are going to be those activities and actions to get us there? So I think we're on a road to great success, and like you guys said, there's a lot of potential here, and I'm really excited about it and really engaging the community in our work.
I too want to welcome you and thank you for being in this role. We're so excited and we're blessed to have someone so talented leading this effort. And you got a lot of work to do, and so we want you to know you have our support. To kind of somewhat report to two boards can be challenging, and to navigate that space, you're the right person for it. So thank you for your report.
Thank you very much. Everyone have a great evening.
All right, we're moving along well here. Dr. Williams, we have quality report. You're recognized.
Thank you, Mr. Chairman. The quality report is in front of you for your review, and I'm here to answer any questions if there are any questions.
Any questions or comments on the quality report? You recognize.
That's this, right?
It's really the quality dashboard here.
There it is. Yeah, there you go. I just have a quick question with regard to, sorry, flipping to the last page. Some of the items highlighted in red, I think we've talked about this before. Can you give us an update on some of the things that you feel like are still outstanding that we've talked about with regard to hand hygiene, sepsis, cesarean, things like that, and just kind of give us an update and kind of trajectory? It feels like some of the same problems keep coming up. So thank you very much.
Some of the challenges that I've been told are due to the fact that we have travelers that are not really invested in in doing some of the detailed work that we like to do, the hand washing, hygiene. Some of them have had some complaints from patients. The other thing is because our numbers are so low, it doesn't take very much to kind of tip that scale over. You know, we're talking about 7 or 8 of these returned surveys. So it really becomes challenging. We're still focusing on it. We have a new person in a role to help us with this, and we just continue to.
Any other questions or discussion?
Can you explain, I'm not sure, like, look at severe sepsis, all in red. The goal of 75%, what does that mean?
I think is,
obviously we don't want 75% sepsis.
no, actually that's interesting. I think that's 75%. Gosh, how is that expressed? Compliance. We want 75% compliance with the sepsis protocol. Yeah. And so we're not getting that. Does that make sense? We've only got 54% of providers using that.
And so how does that track comparative to it? Because again, I think that this is an opportunity. It sounds like for coaching and ongoing monitoring, but how are we comparing with other like hospitals? How are we comparing? I mean, is this a systemic problem maybe in the industry itself? I'm not knowledgeable about that. And then are other hospitals tracking at a higher percentage? So thank you for addressing those.
So what I'll say is for sepsis, it is a problem. I'll say nationally. If you would give me a moment and I could bring it back to the next board meeting, I'm happy to answer those questions. I'll take that piece and we'll delineate it out for further discussion.
Thank you.
Thank you. You good?
Thank you. Any other questions?
We'll need to approve this quality report, so I entertain a motion at this time.
So moved.
It's been moved and properly second. All in favor, vote by the sign of aye. All opposed? Ayes have it. Thank you, Dr. Williams. We will
Continue with the medical staff.
Yeah, you're next.
The update on the medical step bylaws is that we had a very good discussion at the medical executive committee level. We have appointed some new people because some of the folks on the initial bylaws committee have retired. And we did decide, however, to continue to work with the existing document that did not pass. And we want to focus on what specifically was it in that document that we need to change in order to get that over the finish line. And that's because that document is Joint Commission updated, it's updated with CMS guidelines, it's all up to speed, and we think abandoning that and trying to update our current document would be pretty futile. So that meeting is scheduled, the first meeting should be in a couple of weeks. Okay, any questions?
Do we have a representative, or would it be appropriate to have a representative from our board there? I mean, I don't know if it's an open meeting or just to better understand.
It's not a confidential meeting, so if a board member wants to attend, absolutely.
If you can work and Janet can let us know when the date of that would be, that might be great. Thank you.
Okay. Other questions?
Thank you, Dr. Williams.
Okay, I'll stay here for Dr. Burley if you need any help with your report.
I think we're pretty straightforward tonight, though, because we only have two initial appointments. Trent Steffen with family medicine, and then Louis Laskowski in teleradiology. Both of those were moved forward from the Med Exec Committee. Also, we have several reappointments. Paul Butts in emergency medicine, Kenneth Cook in radiology, Samori Cummings from pediatrics, Monica Davis, family and community medicine, and Eva Parker, specialty dermatology. We did have one CRNA that was up for reappointment. There were no issues with those. Where you might be able to help me was with the proctoring with Dr. Turner-Vitus. I noticed it come up one time in the past.
Yeah, so...
Didn't know what actually he had to do to complete that.
Okay, so as you know, we've gotten the robot. We have two physicians, Dr. Turner-Vitus, Dr. Adedokan, who have gone through the training, and the proctoring is that you have to have 6 cases proctored before you're able to operate on your own. Both of them have now completed that. Dr. Turner-Vitus is just now applying for full privileges since he's met the proctoring requirements.
And with that said, I'd like to move them forward for approval. Can I get a second? All in favor, vote by the sign of aye. Aye. All opposed? All right, ayes have it. Thank you, Dr. Burley. Dr. Webb, you're recognized for the CEO's report.
Thank you, Mr. Chair. Good evening to the board. I am a little bit compromised. I'm operating without visual aids. So I'm going to get through this report quickly. National Nurses Week was celebrated May 6th through 12th. Our CNO, Ms. Elders, honored 3 of our top performing leaders, Ashley Mancini, Chris Jett, and Lilia Medina. Is Lilia here? Okay. All right. Congratulations to those high-performing individuals. And National Hospital Week was May 12th through the 14th, and our directors got together and created an extraordinary event that was centered around the Olympics. Lots of fun and activities and throwing pies and all kinds of things. But it was obviously very good for morale of our staff, and they all enjoyed it. On Tuesday, May 14th, Mayor O'Connell held the 61st annual State of Metro address at the fairgrounds. He highlighted 4 of his significant projects, and they are Transportation Improvement Plan, capital spending plan, operating budget, and the East Bank. We hosted one of our state representatives, Caleb Himmer, on Friday, May 17th, as a result of our visits to the Hill. He wanted to come and tour the hospital, particularly wanted to visit the food pharmacy, which we were able to do. He spent a significant amount of time here touring and meeting with the staff. So we're looking forward to continuing to work with Representative Himmer. We congratulate all of the 2024 Meharry graduates on the 149th commencement exercise, which was held earlier in the month. And I have struggled through my report. So that's all I have. Happy to answer any questions.
The good news is we have it in front of us too, so we
Good deal.
What was our request for Metro? You said it was $4 million less than what we had asked for?
What was it, 60? 59. No, what was the request?
63
63. So the budget, which was is the preliminary budget that's been presented to the council, represented a $4 million shortfall on that 63 request.
And compared to what we got last year was
3% higher, Dr. Miller.
3% higher than what we got last. And then we got a supplemental last year too, right? Or was that we got about
that's capital improvement, not supplemental.
capital improvement? So we got capital
Right.
improvement last year.
Yes.
Yeah,
This is operating budget dollars.
Right.
Yeah, but the capital improvement we got last year was like 7, wasn't it?
Yes.
It was significant. It was the largest we'd have.
And is that still pending, or we're not going to get? They haven't offered
No,
that yet.
that's still good.
Yeah. It's in place, and we've drawn about $3.5 million of that 7.3, so
Okay.
we still have about half of it left.
So that's not going to be an option for this year to get another capital improvement.
We asked, but we've never been part of the capital outlay program. It's a long discussion with Metro government that the hospital authority has never been part of the capital outlay plan like they do for the other entities. We're always limited to 4% money, which happens usually 3 times a year. And you're in competition with every agency that needs a fire truck or a police cruiser or whatever it might be. We did get, as you heard Veronica mention earlier, we did get awarded $1.8 million to replace our nurse call and our telemetry system. That's much appreciated. Those are 2 vitally needed systems in the hospital. So I don't want to say they ignore us but we need about $6 or $7 million every year, not just once in 5 years.
I think that was a distribution of surplus funds that were allocated across all of the divisions. So that's not something you're going to be able to count on every year, but it was a good showing for us because we've not received that level of capital in the past. Obviously, that will not be able to be utilized as operating funds, but it is good to offset some of the capital, which we have about $20 million capital list. So it'll help to put an impact on that.
So just for final clarification, Bruce, you said that money it's available if we need it? You can draw off the remaining?
We have way more needs than that 7.3 million.
No, we
So
will use it.
we're going to use it very
Understood.
quickly.
So it's okay to go ahead and draw off the rest of it?
We're already drawing on it,
Great.
yes.
Okay.
We are.
Okay.
Thank you, Dr. Webb, for your report. Just out of curiosity, Miss Elders, since we have these nursing leader award winners here, can you just talk a little bit about them and how you came to that? Yeah.
So first, I'll recognize Christine Jett. So Chris, will you stand up? She is my Senior Director of Nursing. Chris and I have been together the 4 years I've been the CNO, and prior to that, she received the award for work ethic. So when I pull it, Chris is always the first person here, and she's normally, when I leave, her car's still here. And so she's very dedicated to the organization, and she has really helped me expand nursing and our nursing services here. So next to her is Ashley Mancini. She is our Director of Professional Development and Education. Ashley came last year, June the 6th, and has absolutely flipped our education department around, and we're just so excited about having her here. We now have just a really structured nursing education program, and that we didn't have all of those elements in place. So she won the Innovator Award. And Lilia, who's not here, is my Director of Case Management, and she won the Heart of Nursing. She has a love for our patients. She does all that she can in her role, and sometimes I have to say, you can't do that, and she does it anyway. And so she won the Heart of Nursing.
Thank you so much.
Thank you so
much. And thank you all for your service. Thank you. All right, the final order of business is we do need a nominating committee, and it is my responsibility to make recommendations. So I'll start with who I'd like to consider the chair for. Dr. Miller, I think you've done this work before, so I would... Nominating for the chair? For the all officers. Yep. So we're just, the clock just ticks, right? It doesn't stop. The earth doesn't stop turning, so we're at that point again. So if you would be willing to serve as the chair for our nominating committee, and we'll need 2 other individuals. Is anyone in particular interested in serving in this space? If not, I'll start making recommendations. Thank you, Dr. Hudson. And thank you, Mr. Lesser, for... Those are my recommendations for our nominating committee, and I'll make a motion to approve them. Can I get a second? All in favor, vote by the sign of aye. All opposed? Ayes have it. Please note our next regular meeting will be Thursday, June the 27th at 4 p.m. At this time, I'll entertain a motion to adjourn. All in favor? Aye. All opposed? We adjourn.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.